The coronavirus pandemic has some people rethinking their plans to expand or even start their family. More than a third of women say that they're delaying pregnancy or want fewer children because of the ongoing public health crisis that could trigger up to 500,000 fewer births in the U.S. As soon as next year. That's really fascinating. So let us bring in reporter Kate Smith to talk more about this. Kate, it's something that I never really kind of considered. You wrote a piece on this, but people and women are feeling nervous about expanding their family or starting a family because of the pandemic. Why?
That's exactly right, Anne Marie. And they're worried for two different reasons. One, simply health reasons. There's so much that we don't know about the coronavirus in general, and then how that impacts pregnant people in a unique way. And then, secondfold, there's so much economic uncertainty going on. And traditionally, when you see an economic downturn like the Great Recession in 2008 or earlier, you tend to see a decline in births. So, kind of, you have this perfect storm of a public health crisis combined with what we're anticipating to be a gigantic economic crisis. And the result is that a lot of women and families are simply saying now is not the right time to be either starting or expanding a family.
So let us talk about, yeah, the issue with the coronavirus is you're exactly right. There are all these unknowns. And since the beginning of the pandemic to now, it seems like we keep getting sort of more and more updated information about what this virus can do to you and do to children, do to babies. But there's been very little discussion about the impact of the virus on pregnant women. So what do we know? What do we know about how the virus impacts pregnant women and perhaps their unborn children or new babies?
And Marie, when I spoke with doctors, the way they described it is that we are learning more every day, but we understand that there is so much that we still don't know. And again, I think it's important to remember back in March, when New York City, for example, was the epicenter of the virus, there were several days where women who were going into labor, they were forced to deliver alone. And that is just something that is unprecedented. And it kind of shows you how much we're learning. And often, sometimes pregnant people can be the guinea pigs for as we're trying new policies. Right now, though, so for pregnant people, right now, what we know is that if you are a pregnant person, you have a higher probability of being hospitalized if you do contract the coronavirus. You have a higher rate of being ventilated if you are infected with the coronavirus. And again, like we've always said, the coronavirus can impact you in a multitude of different ways. You can have mild symptoms or very severe. So what doctors are thinking now is that women skew towards that more severe symptoms and hospitalization. There's also been recent studies in the past couple of weeks that have been very troubling. One says that pregnant women with the coronavirus are at higher risk of deadly blood clots. And then also, and this is a very new study and it's very troubling, is that there's been a significantly higher, those are the words that the study used, occurrence of stillbirths during this pandemic. So again, a lot of scary statistics if you were a pregnant person. And again, still so many unknowns.
Yeah, those are pretty concerning. And then I add this whole other element because the coronavirus is not just impacting our health, it's impacting the health of our economy. There's a tremendous amount of uncertainty. Often, and we've been repeating this over and over again, when we see a health crisis like this, the people who are already vulnerable are the ones that are sort of impacted the most. So is that also a concern when, people are considering starting a family, having a child, that economically they just don't feel secure?
And Marie, that's absolutely a concern. I was able to speak to more than a dozen women who told me that their plans for pregnancy and family planning have been completely upended by the coronavirus. And kind of the recurring theme I kept hearing was always economic. Every single woman told me there was an economic element where they just weren't financially comfortable right now, and maybe they hadn't lost their job yet. But we don't know what could happen in the future with job losses. Now, in July, what we saw is that women actually were able to gain two-thirds of the jobs that were added back to the economy. But Anne Marie, I'd like to add a little bit of caution there because according to the Bureau of Labor Statistics, 44.2 of those were in the leisure, hospitality, and retail industries. These are industries that we know have two different problems. First of all, they're very culpable to job losses in the future if we, have a second wave,
Mhm.
if there are hotspots emerging throughout the country, like we've seen. And second of all, these people have a much higher increased risk of exposure. These are people who are dealing face to face with the public every day, waiting on a table if they are, working in a hotel. These are jobs that are, they're dangerous to have if you are in an environment of a viral infectious disease like we're looking at with coronavirus. So, even though we did see some improved numbers in July, especially for women, again, a note of caution because there's a second part of that where these are very vulnerable jobs, not only for job security, but then also their health.
Right. And you bring that up, the types of jobs that women are doing, but it's not just women. Well, within the larger group of women, you look at African American women and Latino women, and you are definitely finding that they are more vulnerable when it comes to sort of every single way that this virus can impact you. And I'm sure you're finding it, you found the same thing in doing your research.
That's absolutely right. Latina women had a 14% unemployment rate in July. Black women had an unemployment rate of 13.5%. And of course, this is significantly raised from not only the national average, but even among the average among white women, which was around 11%. So, like you mentioned, you have these populations that are already vulnerable to economic uncertainty to begin with. But what we have found is that in the context of this pandemic, where so many of these face-to-face jobs, leisure, hospitality, retail, so many of those jobs in particular have been vulnerable. These are the communities that are really, having some of the worst outcomes. And I'd like to, look back to say 2008. So many of those job losses were in industries that were much more. I don't want to say diverse. It's hard to call Wall Street diverse, but they had much more white participation in them, right? So when you saw these job losses and the economic fallout from the 2007 2008 crisis, it was much more evenly spread than what you're seeing today. So again, even though you're seeing a pattern come back, you are seeing it much more focused on these vulnerable communities.
And of course, if you think you're going to lose your job, it might also mean that you may lose your health insurance as well. It is very expensive to have a child, even when you have health insurance, and you have to pay those co-payments, several $1,000s. But if you don't have insurance, it's really expensive to have a child. And then what about for people who are choosing not to have children? What about, women who may be trying to find birth control or perhaps, seeking an abortion? How does COVID complicate all of that?
I mean, it's hard to overstate how COVID has complicated virtually every aspect of women's reproductive health, from pregnancy to birth control to abortion services. It's all been very upended by the D's. And I don't mean to laugh. It's hard to imagine how difficult this has been for women of reproductive age. Let's start with pregnancy. Let's say if you lose your job, you're uninsured. Well, like you mentioned, even with insurance, giving birth is an expensive process. I found that it was about $4,500 on average for a completely healthy delivery in a hospital. That's with insurance. If you don't have insurance, completely healthy delivery, that goes up to $30,000. And that is so much money, especially when we talk in the context of the average American doesn't have, $500 in their bank account for an emergency. I mean, I don't think they have $30,000 in their bank account for an emergency like that. It's stunning. And when I spoke to one expert at the Guttmacher Institute, what he told me is that, that's for healthy delivery. When it gets, when you're looking at cesarean sections or any sort of complication whatsoever, it can tick up into the 7 digits. That's more than $1 million. And so we are just talking about, economic prices and just pricing in the healthcare industry that is nearly unfathomable. You talk about birth control. One thing that I found is that a lot of these kind of federally qualified health centers, they are so hyper focused on fighting the pandemic right now that their resources are very limited in terms of what they can do for birth control coverage. Now, what we've spoken about for over a year now is how, Planned Parenthood has been the target of the Trump administration, and they have had, you know, months of being defunded by the federal government. And, now at a moment where these federally qualified health centers can't serve these women who are seeking birth control, Well, now their Planned Parenthood may have gone out of business. They're not offering those services anymore. It's very difficult for women who are seeking birth control coverage, especially ones who are trying to do so at some sort of subsidized cost. And then you get down to abortion, and like we've said so many times, abortion services have been tremendously interrupted during the COVID crisis here in Texas. The state was virtually without abortion care coverage for 4 entire weeks. There's a lot of nervousness in the state right now that could happen again, as you're seeing cases surge throughout states where abortion service has the government has tended to focus on abortion care services and trying to restrict, regulate, and sometimes even just completely ban the procedure entirely. So, like you mentioned, virtually every aspect of reproductive health that you can imagine has been upended by the coronavirus pandemic.
Yeah, yeah. We've been talking about this over and over and over again, but anywhere where there have been ongoing weaknesses, inequality, any of those sorts of things, any sector where that may be taking place, the coronavirus has forced those issues to bubble right up to the surface and it forced them to bubble over. It's really something. Kate Smith, great reporting. Thank you so much.
Thanks for having me, Anne Marie.